All about boils, furuncles, causes, symptoms and treatment of furunculosis, interesting about science and medicine, prepared by editors of a page All Scientific. A furuncle, a boil, is an acute, purulent inflammation of the hair follicle, the corresponding sebaceous gland, and the adjacent subcutaneous tissue. The causative agent of a furuncle is the vast majority of the cases is Staphylococcus aureus, which is characterized by the development of thrombosis in small veins with necrosis of adjacent subcutaneous tissue. Patients with furuncles make up a significant part of the contingent of surgical patients, the treatment of which is with the competence of a paramedic. How does a boil begin? The disease begins with a small pustule located at the mouth of a hair follicle, around which a painful cone-shaped infiltrate 0.5–0.8 cm in diameter develops, gradually increasing in the size. At first, the pain is light, itching predominates, but with the movement and light brush, the pain sharply increases. The skin in the area of the furuncles turns red, and the pustule at the top of the infiltrate increases, and the skin peeling can reach 1–1.5 cm in diameter. On the third–fourth day of the disease, the pustule opens on its own or rupture with accidental scratching, friction of a clothing bandage, and the papillary layer of the skin is exposed, bright red, in the center of which at the top of the infiltrate a hole of 0.51 mm in diameter is visible, filled with a Purulent-Necrotic plaque. This plaque rod consists of a section of a dead tissue. At the same time, several drops of thick, creamy, yellowish pus are released. After another 2–3 days, on the 5th–6th day of the disease, sometimes a little later, the rod is rejected with the release of a small amount of pus, and a small cavity covered with bright pink granulations can be seen in the opening. With the rejection of a rod, the pain decreases and the infiltrate begins to dissolve. After a few more days, approximately on 10–14 day of the disease, the infiltrate is completely resorbed, the purulent cavity is filled with granulation, and the opening heals with the formation of a scar approximately 1 mm in diameter. Complication of boils. However, such an uncomplicated course of a disease does not always occur. Scratching, minor injuries, rubbing with clothing and a poorly applied bandage, and especially attempts to squeeze out a boil, lead to various complications: lymphangitis, lymphadenitis, embolism or purulent thrombosis, sometimes sepsis, sometimes. What happens when the outlet of a boil becomes blocked? In some cases, when the outlet is blocked by dense screws, the Purulent-Necrotic masses are not rejected, and an abscess, limited accumulation of pus, forms the site of a boil. Such an abscessing boil contains up to 3–4 ml of pus, and usually a small operation is necessary to empty it. Why does the localization of boil matter? The localization of boils is of a great importance. If the periarticular zone is affected, the limb movement are limited. Buttock boils prevent symptoms. Neck boils cause severe pain when moving the head, radiating in the back of the head. Perineal boils, which are very difficult to care for, sharply limit walking and are often injured during defecation and subsequent hygiene measures. Particular attention should be paid to patients with facial boils, in particular to chin, lips, and cheeks. Blood clots are especially common in small veins of the face. Facial swelling occurs, the general condition worsens, body temperature rises, chills appear, and there is a risk of sepsis. Particularly dangerous is thrombosis of angular vein of the eye. It's usually visible under the skin of the inner corner of the eye, which has direct connection with the intracranial venous sinus through the superior orbit vein. The spread of thrombosis or embolism of the venous sinus and vein of the meninges threaten the development of purulent meningitis and other life-threatening complications, so squeezing out the core of the furuncle on the face is strictly prohibited. Treatment of furuncles. Uncomplicated furuncle, with the exception of furuncle on the face or partially on the perineum, do not pose a danger to the patient. Some the general condition does not suffer. Patients with furuncles are usually not released from work, especially for patients with furuncles of the face and perineum. The presence of a furuncle prevents the performance of a work leading to preparation of food products. In the infiltrate stage, it is possible to achieve a reverse development of a process. For this purpose, a thorough dilate of the infiltrate circumference is performed. The hair is cut with small sharp scissors or careful shaved without touching the infiltrate zone. The area of the furuncle is washed with soap and warm running water. The infiltrate is lubricated with a concentrated 5-10% solution of iodinate and sealed with a piece of bactericidal adhesive plaster, so that the plaster extends at least 1 cm beyond the infiltrate. This sample technique protects the furuncle for scratching and microtrauma with raw clothing and thus promote the reverse development of the infiltrate. It is rational to perform ultraviolet therapy of the furuncle area to act with ultra-high frequency. Already the next day and sometimes yearly, it became clear whether it was possible to interrupt the inflammation or not. In the first case, the pain and itching will sharply awaken it and stop altogether, and if the development of a furuncle is not stopped, they will remain at the same level. On the 4th-5th day, the Purulent-Necrotic plaque has already been rejected or is beginning to be rejected. The resulting hole, 2-3 mm in diameter, allow you to insert narrow branches or surgical tweezers, like eye tweezers, into it, and having grasped the rod, try to extract it. This is usually easy and painless. After additional toilet of a furuncle circumference, including lubrication of the skin with 1% alcohol solution of brilliant green, a small piece of aseptic gauze 1.5-2 cm in diameter is applied to the infiltrate, which is again fixed with an adhesive plaster, usually 4-5 cm or slightly larger. Both at the infiltrate stage and subsequently, the use of any compresses is unacceptable. The compress contribute to spread of infection or neighboring hair follicles and the development of several more furuncles in the neighborhood. More often, patients with a furuncle seek medication attention, not in the initial period, but later, when the reverse development of a process is no longer possible. Then, to speed up the formation of a hole through which the Purulent-Necrotic masses will be rejected, it is recommended to put a crystal of potassium permanganate on the top of the infiltrate for 1 day. Sprinkle a little salicylic acid or use proteolytic enzyme. A bandage of 4-6 layers of aseptic gauze, 3-4 cm, is applied on top, which is fixed with an adhesive plaster, as described above, or 3-4 strips of adhesive plaster 1 cm wide, 8-10 cm long, laid in a star shape. Dressings are made after 1-2 days, including after removal of rejection of a Purulent-Necrotic core. Rejection of a core and resorption of an infiltrate are significantly accelerated by simultaneous treatment with ultra-high frequency or ultraviolet current. Surgical treatment of furuncles is indicated only in case of abscess formation. All patients with facial furuncles are subject to inpatient treatment. Bandages are not applied to the face. Ultra-high frequency therapy is performed in surgical department. Intensive antibiotic therapy is also performed. What is furunculosis? This term defines the repeated development of several furuncles in the same or several areas of the body. Some surgeons regard furunculosis as a manifestation of sludgy staphylococcal chronic sepsis, and in some cases, with persistent searching, it was possible to isolate the pathogen from the blood, Staphylococcus aureus. Causes of furunculosis. In most cases of single furuncle, it is possible to find the cause of a disease, minor injuries, violation of hygiene rules, specific feature of work. When that furunculosis is the main causes of a disease are decreasing the body's defenses, weakened by serious illness, hormonal disorders, blood disease. In some cases, including the repeated development of single furunculosis, Furunculosis is associated with latent diabetes. In this regard, it is necessary to repeat the urine and blood test for sugar content, and if diabetes is detected, vigorous targeted treatment of the underlying disease. Treatment of furunculosis. Treatment of furunculosis is complex. Along with careful implementation of local measures described above, general treatment is carried out aimed at strengthening the body's defense. The following are prescribed: systematic vitamin therapy, vitamin C, A, B1, enhances rational diet, general health treatment, physical therapy, walks, bathing in clean running water, or washing under the shower. Vaccination therapy, preferable auto-vaccine, blood transfusion including form of vaccinated donor are effective. Auto-transfusion of a patient's blood irradiated with ultraviolet rays using a device for ultraviolet irradiation of blood is very effective. In some cases, auto-chemotherapy is very effective. In some cases, patients are transferred to other work not associated with oil products, chemicals, or phases. Prevention of boils and furunculosis. Prevention of boils and furunculosis consists of observing sanitary and hygienic rules, especially in the jobs listed above. It is necessary to ensure daily showering after work and changing special clothing to clean, disinfected with steam without the use of chemical disinfectants. Thank you for your attention. This material was prepared by editors of the page of scientific attention. This material is for information purposes only. When observing very unusual symptoms, recommend to consult a doctor. Subscribe to our channel. Thank you. Bye bye.